Hi, and welcome to the 5-Minute Check-In. Thanks for joining me. And today we're going to revisit winter viruses. And to have that conversation with me today, we have Dr. Renuga Vivekanandan, who is an infectious disease specialist, a professor at Creighton University, and the CMO for our Midwest region. Renuga, thanks for joining me.
Oh, thank you so much for having me, Dr. McGinn.
Great. So, we talked about this earlier. We didn't have that much data because it was the beginning of the season, and we're, just taking a look at this, and now we're revisiting it now that we have data. And we're going to attack this one virus at a time, and we'll start with the most common virus, and that's influenza. So tell us what's happening in the world of influenza these days.
Good news, influenza activity is still on the lower rates, but however, you could see it starting picking up in like Texas, Phoenix market. So it's really something to keep an eye out for. And of course, as the disease increases, we need to be getting vaccination. It's never too late to vaccinate for influenza. So that's going to be really important for us to communicate with our patients and providers.
Yeah, never too late. Never too late to get vaccinated. So, and what are we seeing in terms of the pattern this year?
Yeah, it's really great question. If you look at this graph, before the pandemic, you had a really nice influenza curve. But during the pandemic, you could see when we all wore masks, the curve went down really low.
It's completely
Now,
flat here. It's amazing. I mean,
yes, yes,
completely, the masks just flattened out the curve.
yeah, which was fantastic. But when we took off the mask, you could then see the curve going up significantly higher. But this year, when we look at the graph, though, it's going back to the pre-pandemic rates, which is great. But again, I think it's important to get vaccinated and make sure we're protecting each other.
Right. Yeah, no, interesting. These graphs almost tell a real story, where pre-pandemic normal curve, mask flattened, take the mask off, peaks, now coming back to normal. So it just interesting to look at that data. All right, let's talk about COVID and what's happening out there in the communities as we look at these data points.
COVID-19 is also remaining low. However, again, we need to vaccinate to make sure we are protecting ourselves because I expect the rates to go up as the winter months continue. What is really nice is we could have a surrogate marker, so you could look at the sewage water and detect how much COVID activities in the community, and that is also saying low activity at this moment.
Right. And very, very low hospitalizations for this. So this could be that, we are going to even see, hopefully, if we do have an uptick in the COVID infections, we still have that, low hospitalization rate.
Agree. And I also think it's going to be important if you do get the infection, you could also seek for antivirals with your primary care provider too. So just remember that as well.
Got it. All right. And RSV, which we had typically talked about in the last couple of years with some of the advances in that vaccine, particularly getting into the very young children, but also some of the some older folks.
Yeah, if you look at the influenza-like illness activity, it kind of puts influenza and RSV together. So
Mhm.
that rates are slowly climbing up. So we do expect RSV activity to go up. So it's going to be really important for patients 75 and older to be able to get their vaccination this year. If you're between 60 to 74, talk to your primary care physician. If you have comorbidities, that might be something you want to consider. But what's really important is if a mom is pregnant to be able to get vaccine to protect the newborn baby. And also if a newborn baby is can also get antibodies to protect themselves as well if the mom didn't get the vaccine. So there are a few options for us.
Yeah, I think it's just so much new science in the RSV vaccine space, particularly around moms, pregnant moms. So very interesting. All right, well, let's talk. It's really not a virus, but pneumococcal pneumonia. Let's talk a little bit about that because that usually, starts to increase a little bit during the influenza season.
Definitely. I think, pneumococcal vaccine is very important. So vaccinating 65 and older, high risk patients are going to be really important. But I also want to remind everybody, especially during influenza season, our patients get post-influenza pneumonia during that time when we are giving antibiotics to make sure we're covering our patients for MRSA and MSSA as well.
Great. All right, so we covered the big four. And just again, re-encouraging our providers and our patients, never too late to get vaccinated. Holiday travel. Everybody's going to visit grandma, grandpa, grandkids, parents, during the holiday season. Any thoughts on that?
Oh, everybody should travel, see family, enjoy the
Good for the
holidays.
travel agencies. It's all good
Yes,
for the whole the travel industry. So yes,
yes,
we should all travel.
yes, definitely. But also being responsible. So, being vaccinated if you're ill, not traveling, if you're around, elderly or immunocompromised folks, wearing a mask, just those human kindness things to do.
Yeah, so just be thoughtful, and particularly if you're not feeling well, wear that mask. So last point, I know there's been some news about disease X. Any ideas about, what this is and anything we should be concerned about or just be aware of?
Yeah, disease X, it's in Congo, they have had about 400 cases. So CDC, WHO, they're all investigating it. It seems like a respiratory illness, cough, runny nose, fevers. They have had some mortality. So there's a lot of investigation that is happening. They haven't identified the cause yet, but I think very low risk for any of that to be here. So we'll keep an eye on.
Great. Well, you may see it in the news. Well, Renuga, thank you for joining us once again. Appreciate all your insights and inputs and everything you do for Common Spirit Health. Thank you for joining me, and I'll see you at the next 5-minute check-in.